Good afternoon, everyone, and thank you for joining us today. I'm Desi from Clean Air Partnership, and our guest speaker today is Kim Peralta from Canadian Health Association for Sustainability and Equity, or short CHASE. I will introduce Kim shortly, but first I wanted to start with land acknowledgement. Clean Air Partnership is a Toronto-based organization, and we acknowledge that the land on which we operate is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. In our effort to do a more meaningful land acknowledgement, we are showing short videos from Indigenous people so we can learn more about their culture and life. In this video, we are going to hear a brief but spectacular take on being a good ancestor by Camille Seaman.
Art is not only important, it is necessary for us to communicate what is happening with our planet. Without art, I don't think we will ever truly be able to communicate what climate change is. I had an incredible childhood. Primarily, I spent time at my grandparents' house, and my grandparents are of Shinnecock and Montaukett descent. And my grandfather especially thought it was very important for us to know that we were interconnected and interrelated with all beings. As a small child, he would take me into the woods and introduce me to each tree. And he said, this is your relative in the same way that I am your relative, and you must respect it. When I saw my very first iceberg in Antarctica in 2004, I remember just shaking because I was thinking, how many snowflakes is this? How many ancestors' water is this? And so when I photograph them, I am literally photographing the water of my ancestors, as if I am making a portrait of my ancestors. I feel that a photograph is not successful if it's only giving you information without helping you to feel something. If you look at one of my photographs and feel nothing, I have failed. I look at the glaciers that I've photographed, for example, in Antarctica, and those glaciers look crumbly, unwell, unsafe. The climate change that I have witnessed in my now 20 years of visiting the polar regions is shocking. I hope that humans will realize that we are of this earth. We only get this one. And one day we will realize just how special it is. I just hope it's not after we have lost so much of what makes it special. My name is Camille Seaman, and this is my brief but spectacular take on being a good ancestor.
Spectacular.
Thank you for watching. I haven't seen a glacier in real life, but I did got goosebumps when I saw her pictures. I wanted to share with you a course we developed with the purpose of informing elected officials or general staff that not necessarily works with climate change. That we developed this course to support the spread of knowledge and like what it means climate action on a local level. Feel free to take a look of it or recommend it to someone that you think it's going to be interested. I'll share a link to it in in the chat just shortly. And lastly, our upcoming events. This Friday, we have the Sustainable Fleet Community of Practice meeting, and we're going to summarize everything we learned last year on electrification of the fleet, as well as we will be seeking what topics of our interest for next meetings. And on March 13, we are going to talk about the district energy in Ottawa's ESSA project. I will share a link to our event page where you can find more information and register. But the best way to stay tuned of what is coming up from Clean Air Partnership is by subscribing to our newsletter, and I'll post a link to that as well shortly. But now I wanted to officially welcome our guest speaker, Kim. Kim is an environmental health specialist who has been promoting environmental and built environment policies from a health perspective for over 30 years. She's currently the executive director for CHASE, the Canadian Health Association for Sustainability and Equity, a nonprofit organization directed and run by public health professionals. Thank you, Kim, for being with us. Thank you so much for the work that you do. And you can take it away. I will share your presentation now. Yes.
Hi, Desi. Thank you for that introduction and for sharing that beautiful video. That was really incredible. So thank you. I would just like to say that I'm calling in today from the city of Hamilton, which is situated on the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. So what I'm going to be speaking about today is climate change mitigation, not climate change adaptation. I'm going to be speaking about the health and health equity arguments that can be used to inform and support local climate solutions. Next slide. So over the last 2 years, we at CHASE have collaborated with the Canadian Public Health Association, the CPHA, and the Ontario Public Health Association, the OPHA, on a project that was funded by the McConnell Foundation. We produced 14 brief case studies that were published and shared as blogs. We organized 4 webinars with speakers from 10 of the projects covered in our case studies, and we produced a report. The report includes edited versions of the case studies, but it also includes a summary of some of the health and health equity evidence that's linked to the 5 local climate solutions. So for today's presentation, I'm going to be really focusing on that part of the report. The part on the case studies, that was kind of more directed more specifically for the public health sector to kind of inspire them and show them strategies that are being used by other health units across the country. I do think that people working in the municipal sector might find some of those case studies interesting because it might help them to see how they might work with their public health agencies if they're not doing so already. So the report and the case studies and the webinars are all available on our website, and the link is provided there. Next slide. So we had several goals with this project. One of them was to encourage public health professionals to become more active in educating the public about climate change solutions. One communication survey actually tells us that while a significant percentage of people in Canada are very concerned or concerned about climate change, very few can actually identify the actions needed to fight it. I think this is because we who work on climate change issues often use abstract terms. We talk about cutting greenhouse gas emissions by percentages, by dates, and we talk about things like carbon taxes and that. And I think the problem is that we haven't actually shown people enough, but what that actually looks like. So it seems to me that we need to paint a clearer picture for people so they know what a carbon-free world looks like, and so they can really recognize the policies and the investments that are needed by our governments to fight climate change. Public health is well positioned to do this because they're already working on a number of interventions that are actually climate solutions, only public health is often working on them because of the immediate health and health equity benefits associated with them. So I think for me, one of the things is just to say to public health, let's just be more explicit, let's be more vocal about the benefits for climate change when we're doing our work, while also talking about it from the health perspective. Next slide. The second goal was to really encourage everyone, public health, community groups, municipal staff, to use health arguments to support local climate solutions. Clearly, this is not in place of other great arguments that people will be using or already using. The idea is to add the immediate health and health equity benefits to the suite of arguments that can be used to support climate solutions. We in CHASE have seen firsthand how effective it can be to use immediate health benefits to win public policies related to climate change. We've seen it with coal plants in Ontario and in Alberta. We've seen it with federal funding for the National Active Transportation projects. We've seen it with the replacement of old heavy emitting school buses with new school buses built to updated emission standards in Ontario. We hope to see more of that. This approach is also backed by research. For example, one study in the US found that the public can be motivated to support climate solutions when they're presented with three messages. One, the health risks that are presented by the changing climate, the health benefits associated with climate action, and clear calls to action. And this study actually found that when all three messages were used together, that the messaging could actually influence the attitudes of people from across the political spectrum, which seems to be very important at this time. Next slide. So the third goal was to ensure that health and health equity impacts are being considered when we're redesigning and redeveloping our communities. I think given that significant investments will be made in our communities over the coming years to transition away from fossil fuels and to increase our communities' resilience, it's important that we maximize the benefits and that we don't miss the opportunity to make our communities healthier and more equitable at the same time. In some cases, people will actually find that the health-related savings associated with a climate action can actually pay for the investments that are needed. Next slide, sorry. Got ahead of you. So what do we mean by health inequities? In public health, we've known for a long time that certain populations are at increased risk for adverse health impacts because of socioeconomic and environmental factors that we call the social determinants of health. This includes factors such as income, gender, race, immigration status. More recently, people working in the field of health equity have been getting clear about explaining that the increased health risks experienced by these populations often have to do with interpersonal and systemic biases in our society, such as sexism, racism, and colonialism. So when we're trying to address health inequities in our communities, we're trying to correct the processes and the policies that contribute to them, at least those that are within our control and whatever work we're doing. Next slide. When we were deciding which climate solutions to focus on, we looked at the Intergovernmental Panel on Climate Change Working Group, the one that was working on climate change mitigation, and we looked at the list that they had for local climate solutions. And we also looked at one of the early Lancet reports on health and climate change, and it identified a number of climate solutions that also produce health impacts or health, positive health benefits. So we selected 5 actions from those kind of lists. And we settled on investing in public transit, developing walkable communities, building safe and connected active transportation infrastructure, creating green or greener buildings. By that, I mean building retrofits, energy efficient buildings, enhancing carbon sinks with nature-based infrastructure, such as trees, parks, and forests. Next slide. Oh, hang on, we're a little out of sync here. Can you go back one, Desi? Thanks. Okay. So 3 of the 5 climate solutions are related to the transportation sector. Well, there are a number of health benefits associated with all 3 of these climate solutions. There are 2 risk factors that can be addressed by all 3, and that's air pollution and physical inactivity. So just want to kind of touch on those briefly first. So while we've made substantial improvements in air quality in Canada over the last 2 decades, air pollution continues to be responsible for a significant burden of illness. Health Canada estimates that air pollution is responsible for about $180 billion per year in health-related costs, and those are conservative estimates. Traffic-related air pollution is a pollution that hovers around high-volume traffic corridors. It can extend from anywhere from 50 meters to 500 meters, but the closer you get to the highway and the higher the volume of that highway, the higher the concentration of air pollutants around it and the more hazardous it is. So traffic-related air pollution has been linked to a broad array of adverse health impacts, everything from aggravating symptoms of asthma, causing strokes, increasing the risk for cardiovascular disease, lung cancer, possibly childhood leukemia, and breast cancer. And so a few Canadian studies have actually found that neighborhoods with higher levels of material deprivation are more likely to be located near high volume traffic corridors. And traffic related air pollution is the #1 cause of kind of the variation in air quality across most urban centers. It'd be a few urban centers that have, a lot of industry, where industry will have a heavy impact. But for many of the urban centers in Canada, traffic will be the source of the most variation within the community. So Health Canada has also reported that a third of the schools in Canada and 40% of the long-term care facilities, so these are institutions that house populations that are sensitive to air pollution, our young children and our older populations, that these are within 100 meters of high traffic roads. So that means that they're in a fairly concentrated field of air pollution. Next slide. So chronic diseases are really swamping our healthcare system in Canada. And it's been estimated that those diseases such as cardiovascular disease and diabetes, are responsible for about 150,000 premature deaths per year in Canada. And it's been estimated that they're associated with about $200 billion per year in health-related costs. I want to be really clear when we talk about health-related costs, we're not talking just healthcare. We're talking about, lost time. We're talking about doctor's visits. We're talking about how you value a life lost. But still, we're talking about $200 billion per year. We're talking about a huge impact on our healthcare system and a huge impact to the quality of life and the length of people's lives. Type 2 diabetes is a particularly costly disease, both in terms of the quality of life and in terms of healthcare expenses, and it's on the rise. The good news is that physical activity has been clearly shown to reduce the risk of 25 chronic diseases. And in fact, research has demonstrated that the risk of early deaths can be cut by about 26% with 150 to 200 minutes of moderate to vigorous physical activity each week. And this is why so many of us are out there trying to get our 30 minutes of walking each day. Next slide. So with the 5 climate solutions, I'm going to provide a very high-level summary of the arguments and evidence that's offered in our report. And then I'm going to highlight some of the newer key findings that I think are really valuable. So I'll be making very broad statements just in terms of keeping things tight and on time. So with public transit, a number of modeling studies have demonstrated that investments can, particularly when paired with improvements in the built environment, making the built environment more transit supportive, that can produce significant reductions in emissions of both air pollutants and greenhouse gases. Several studies have also demonstrated that people can get a good deal of the physical activity that they need to stay healthy by simply walking or cycling to and from their transit stops. And a number of modeling studies have actually estimated the impacts the value of the health-related benefits associated with it. And those studies have demonstrated that we can produce billions of dollars in health-related benefits by investing in public transit and getting people into transit because of the reductions in air pollution and the increases in physical activity. Next slide. So public transit is also really important for addressing health inequities because it increases access to jobs, to services, to recreational opportunities for the many people in our community who cannot drive because of age or ability, or who do not have access to vehicles. So it has the promise of doing this as long as the service is good throughout our communities. It can also reduce the cost of living for people by eliminating the need to own and operate a car, which is extremely expensive. It can also reduce vehicle-related deaths in the community, and that's because the fatality rates associated with collisions associated with transit vehicles are much lower, but also because the view is that because if you have good transit service, people who are engaging in high-risk activities like going out for drinks in the evening are more likely to use transit than to get into their cars at night. Unfortunately, about 5% of the people in Canada, about 1 million people, live on lower incomes and live in neighborhoods with poor access to public transit. And often these are the people that are kind of on the periphery of our communities where the transit service is not so good, or where the community is a little more sprawled and it's harder to provide efficient transit service. Next slide. So hundreds of studies have been directed at the impacts of active transportation on physical activity and health over the last few decades. Those studies have demonstrated that safe and connected active transportation infrastructure can produce all kinds of health benefits. It can encourage walking and cycling as modes of transportation. It reduces emissions of greenhouse gases and air pollutants. It increases the safety of pedestrians and cyclists. It increases the levels of physical activity, and that in turn improves the health of the population in a very significant way. These studies have found that active transportation infrastructure is particularly important for women, older populations, and those with mobility challenges. And these are groups that have not always been considered when we've designed and developed our transportation networks in the past. Next slide. One particularly powerful study that was conducted in the UK, it followed 250,000 people in 22 communities over 5 years, and it found that 80 to 90% of cycling commuters and 50 to 54% of walking commuters achieved the levels of physical activity recommended for good health with their commutes alone. It also found that cycling commuters reduced their risk of cardiovascular disease, cancer, and premature deaths from all causes, and these were statistically significant results. It also found that walking commuters reduced their risk of cardiovascular disease. So the researchers themselves made a note in this study saying that these results demonstrate that active transportation can provide major improvements to population health in our communities. So again, that translates into many lives saved, many diseases prevented, and huge savings for our healthcare sector. Next slide. So hundreds of studies have also been directed at walkable neighborhoods over the last few decades as well. So studies have looked at the characteristics of a neighborhood that encourage walking as a mode of transportation, how various neighborhoods affect levels of physical activity, weight of the population, health outcomes in the community. And the 5 factors that show up in studies repeatedly, or not always consistently, but repeatedly, are the 5 Ds: density of jobs and population, diversity of land uses within walking distance of one another, road design, access to population, popular destinations, and distance to transit. So different variations of this have been used, of these characteristics have been used in various studies, but the overall, the studies have found that walkable neighborhoods can reduce emissions of greenhouse gases and air pollutants by decreasing the use of cars and the vehicle kilometers traveled, that they can increase the levels of physical activity across the community, can reduce the weight, the risk of diabetes, and the risk of premature deaths among people in the community, and that this can have greater health benefits, particularly greater health benefits for people who live on low incomes. Next slide. So one pivotal study that followed 1.8 million adults in Canada over 15 years found that relative to those living in the least walkable neighborhoods, those living in the most walkable neighborhoods were 9% less likely to die prematurely from cardiovascular disease, 13% less likely to die prematurely from a stroke, and 3% less likely to die prematurely from all causes. So these are huge health benefits. Again, in terms of the impact on the quality of people's lives and on the length of people's lives and on healthcare costs. This study also found that those living in the most walkable neighborhoods who had little education, who lived on low incomes, who lived in highly deprived neighborhoods were actually 9%, 5%, and 25% less likely to die prematurely from cardiovascular disease than similar populations living in the least walkable neighborhoods. So again, this study emphasizes that walkable neighborhoods are incredibly important to the overall health of our community, and particularly so for higher risk populations. Next slide. The next 2 climate solutions, green space and green buildings, have extreme heat as one of the common health risk factors. So I'm sure that most of us know that the heat dome that hit BC in 2021 had a devastating impact on human health. It gave rise to over 600 premature deaths. Several studies conducted in Quebec have also brought to light the fact that extreme heat resulted in 291 deaths in 2010 and 86 deaths in 2019. The fact that we don't hear numbers for other communities in Canada can lead us to believe that extreme heat is not causing deaths across the country, that it's a problem only in these 2 provinces. And this is not the case. It's simply that this is where we've had really good studies that have really kind of gone in and looked at the numbers and done the analysis. One study that looked at 26 Canadian cities estimated that the extreme heat is increasing premature deaths by 2 to 13% across the country. Next slide. When the BC heat dome was examined by researchers, they found that deaths in the community, and what they mean by that is among people who are not living in institutions like long-term care facilities, the deaths in the community increased by 440%. The death rates were much higher for people between the ages of 65 and 74, among low-income populations, among people in the homes that lacked air conditioners, in the neighborhoods that were less green, you had fewer trees and green space, etc., and in neighborhoods with higher building densities. So these are really good indicators of what needs to change in order to reduce the harm caused by extreme heat in our communities. Next slide. So green space, by which we mean grass, gardens, and trees, it's, many of the people on this call will know that it can act as carbon sinks in our communities, and so can, is important in terms of from a climate change perspective. But green space can also serve a number of health, or provides a number of health and health equity benefits. First of all, it can cool air temperatures. I think that's something that many of us knew. Can also capture and filter certain air pollutants. And so studies have actually suggested that the air cooling and the air cleaning properties of green space can have an effect on a very local neighborhood, but like collectively, if you have a number of different parks and green spaces, collectively it can actually have an impact on the community as a whole. One Canadian study has demonstrated that what many of us believe intuitively, that materially deprived neighborhoods in our communities are more likely to have higher levels of traffic-related air pollution, to be less walkable, and to have less greenery or less green space. Next slide. So over the last decade, a great deal of research has been directed at the health benefits of green space. There's a growing body of evidence which suggests that green space decreases stress, the symptoms of ADD and ADHD, depression, that it's good for mental health, that it's associated with healthier births and healthier weights, improved cognitive function, particularly among children, and a decreased risk of diabetes and premature deaths from all causes. These studies suggest that children in particular and lower income populations are the ones that can benefit most from green space in their neighborhoods. The one long-term study that was directed at 1.3 million Canadians found that those who had higher levels of greenness within 250 to 500 meters of their homes actually had premature death rates that were 8 to 12% lower for 6 common causes than those who had lower levels of greenness near their homes. And again, these are astounding numbers. These are numbers that we're talking about huge impact on population health, huge impact on healthcare costs for us as a society. Next slide. So green buildings and building retrofits can produce significant reductions in greenhouse gas emissions. I'm sure this is not news to many of you on this webinar. The International Energy Agency has estimated that energy demands for space heating in Canada can be reduced by 85% by 2050 by improving building envelopes and installing heat pumps. So green buildings and building retrofits can also reduce emissions of air pollutants. We know that oil and natural gas used to heat our homes and our water and our workplaces release nitrogen oxides and other pollutants when burned. So any action that substantially reduces the energy used in our buildings is going to reduce emissions of those air pollutants in our neighborhoods. Next slide. So cold climate air source heat pumps can now operate to temperatures as low as negative 25 degrees, and these are being used in many communities in Canada and in Europe. These devices can completely replace our conventional oil or natural gas fired furnaces and our air conditioning units. And they use 70% less energy than conventional home heating. So they will produce significant cost savings for households and businesses while also reducing greenhouse gas emissions. Next slide. So looking at a number of studies, and there's not an extensive number of studies now, but looking at a number of studies that were out there, green buildings and building retrofits can potentially improve indoor environmental quality, or IEQ. Poor IEQ is associated with a broad array of health impacts. It can increase the risk of cardiovascular disease, strokes, premature deaths, asthma, and respiratory diseases. And they're linked to conditions such as extremes in temperature and drafts, viruses and bacteria, mold and dampness in homes, and air pollutants and toxics from indoor activities. That would include something like, using a natural gas stove in a house, and also from furnishings and consumer products that can emit harmful pollutants. And that could include things like phthalates and formaldehyde. So poor IEQ can actually amplify health inequities because higher risk populations are more likely to live in households with poor IEQ, and because these populations are less likely to have the resources to protect themselves. And extreme heat is a really good example of this latter point. Next slide. So a number of studies have been directed at the impact of green buildings on the health of occupants in those buildings. These studies have found that green buildings can improve comfort. Green buildings and building retrofits can improve comfort, overall health, respiratory health, and mental health. And the retrofits that we were looking at in these studies that I was looking at, a few of them have been directed at multifamily homes and affordable housing. And in these cases, they were making kind of insulating the home, the buildings, replacing windows to improve the insulation. And sometimes they were replacing ventilation systems or updating them, and sometimes they were actually replacing indoor sources of air pollution or removing those indoor sources of air pollution. So it's kind of a mixed bag in terms of, we're looking at a number of different studies. Some are looking at different interventions, some are looking at different health impacts. But there's a number of studies out there that suggest that this can really be an improvement in health and health equity. Heat pumps can reduce health inequities by protecting people from extreme heat, by reducing energy costs, and potentially reducing energy poverty in some households. Now, researchers in the field of IEQ have noted that care is needed when we are increasing the air tightness of a building, that we're also addressing existing sources of air pollutants by including things like mechanical ventilation or heat recovery and filtration, or by removing the sources of air pollution. So this is a very in-depth field, and I feel like I'm just scratching the surface here. But I think this is an area where we need more discussions between those of us who maybe work in public health and those who work in housing or energy efficiency, so we can kind of understand more about what's being done. Next one, public health agencies. So a report does include 14 brief case studies. 4 of them are directed at municipalities and nonprofit organizations that are doing really interesting work with, one's looking at the use of on-demand transit service. One is looking at in Nova Scotia, kind of a nonprofit organization that works with different providers of transit service across the province, and they're actually providing service for people across the province between their communities. And so really serving older people, people with mobility challenges, people who cannot drive or do not have vehicles. And 10 of the case studies were conducted with public health professionals that are working to influence policies related to one or more of the 5 climate solutions. Now, with those public health people, sometimes they were doing it with an explicit acknowledgement of the link to climate solutions, and other times they were not. Sometimes they were just doing it for their health and health equity purposes. I'm not going to go into those examples today. I think those were designed more for public health, but again, people might find some of those very useful to look at. I'd just like to take the opportunity to explain how public health agencies function. Depends a lot on where they're situated or how they're situated. In most of Canada, public health agencies are arm's length agencies of the province. And so that really impacts how they relate to local municipalities. In Ontario, public health agencies can be departments within local municipalities like Toronto and Hamilton. They can be departments of regional municipalities like Halton, Peel, Durham, and York regions, or they can be agencies that report to independent boards of health with representatives from different communities within their catchment area, like the Simcoe Muskoka District Health Unit. So with our 10 case studies, we've tried to capture examples from the various different models so public health professionals and their partners in the municipal sector can see what strategies might be useful or applicable to their situation. And one more slide here. I just want to give a little bit of a pitch for the 2022 report that was prepared by the Chief Public Health Officer of Canada, Dr. Teresa Tam. This report was directed at climate change, and it emphasizes that while it's important for public health to engage in the development of climate change adaptation plans to minimize health impacts associated with the changing climate, it's also critical to put health at the center of climate action. And so in this report, she's really speaking to kind of what we're speaking to today about how important it is for us to be addressing health and health equity and climate change solutions at the same time. And next slide, and that's it. I'm open to questions if there are any.
Thank you so much, Kim, for this presentation. Take a breath a little bit and a sip of water. I know that it's a lot to cover. I wanted to say that the presentation and the report itself, it's a great source to point out additional science information for already actions that either the municipalities, climate actions that are either already in the climate plans, or for those municipalities who are developing right now their climate plans. There's a lot of information there that can be linked. And the benefit of those who are right now in the developing their climate action plans is that you can incorporate equity from the beginning, pointing to those studies that are part of the report that you just shared, Kim. Thank you so much. Something that also you started with this, and I think it's linked a little bit with the video that we showed in the beginning. It's the importance of communication to the community of the impacts of climate change, I like how you admitted that it's like there is still need more work to be done there in order to prepare the communities for kind of like for the why the actions that needs to be taken and why the municipality is doing this, but also for the preparedness from a resilience perspective. Okay, so a few questions here. The first one is, I feel like the vast majority of folks who own homes may not be aware of some of these retrofits, such as the updated heat pumps and cooling mechanisms. How is this information being translated to the general public so that home and business owners are aware of this? And is this an affordable solution for most of the people? Kim, if you want, I can take the first part of this question, because
Sure.
I did share a link in the chat of a heat pump toolkit that we developed, Clean Air Partnership, together with there was someone that was helping us, but it's basically a toolkit that it's promoting heat pumps for the communities, and every municipality can use it in order to spread the word and kind of like educate the community. We also do community webinars. There is one coming up on heat pumps specifically. I can share the date of it shortly. I just need to look. Yeah, how the information is being translated is, I know that it's not just us. I know that there are other organizations there, that TRCA and their STEP program, they did a lot on heat pumps and working with the communities. And on the second part of the question, and is this an affordable solution for most of the people? It is affordable solution. It is more and more experience from, because recently we had actually a webinar where two families that live here in Toronto presented their retrofit projects and the savings that they have from the electricity bills. It's a bit like difficult to grasp it and to think about it, because you do need to put the investment upfront of getting the heat pumps or doing the retrofit. So there is upfront cost, but the return of investment is there because you save a lot from electricity bill. That's kind of like, Kim, I don't know if you want to add
And
something.
maybe while you're looking at any other questions, Desi, maybe I could just also just want to say to people, there's a new tool that's been produced called healthyplan.city. And it was produced by some of the leading kind of epidemiologists in the country who look at environmental health issues. And it was done with funding from the Public Health Agency of Canada. And this tool actually allows it. They've put all the data in there for across the country for 125 municipalities, and it actually allows people to look at, I think it's 12 different built environment indicators. So it includes average summer temperatures is one of the built environment indicators. It also has things like tree canopy in it, and there's kind of an indicator for walkable neighborhoods. So there's a number of indicators in there, and then you can overlap it with what they refer to as a vulnerable population, but kind of one of the populations that kind of have health equity considerations. And so you can actually put it in there with something that says, let's say, low income individuals would be one layer of data, and another layer of data might be tree canopy. And they've actually kind of show the priority areas in our municipalities where we need action to kind of, address some of those inequities. So that's a really nice tool. And I'm sorry I didn't put a slide in the presentation, but I think it's a really nice tool. It just kind of, they've been working on it for years. It just came out a few months ago.
Kim, I can try to find it. What was the name of it?
Healthyplan.city. And it's a web-based tool.
Okay, I will try to find it, and I'll share it in the chat. Meanwhile, I invite everyone that is on the call. Feel free to also raise your hand if you want to ask your question. Oh, thank you, Nicole. Nicole, find it and share it. Feel free to if you want to ask your question or even a comment. Something that you mentioned in your slides of the extreme heat, and I know that we've discussed with you as well, and I want to kind of like share with our audience as well that it is a topic that I'm trying to bring in, so and talk with our municipal staff and some experts from the health and equity perspective on the extreme heat events and the preparedness, because summer is coming and we'll see more of those events happening, and what are the actions that can be taken from municipalities, and also how to prepare the community on that. I was just on another webinar, I think it was 2 days ago, where they presented what's that community in City of Toronto, St. Jamestown, a great community-led program where they have a WhatsApp group, and the whole community, the neighborhood, and they were able to respond to. I think one of the events was like the heat event, and they were sharing tactics of what to do, where to go, where is like the coolest area in the region. So I thought that that's like a great example, and I want to brainstorm a little bit more with everyone interested in this topic of what are this kind of like tactics. I don't know if it's a policy specific, but it's more like actions that we can communicate to the community, but also the municipalities can use.
And maybe if there's no other questions, maybe I'll just offer to people that in terms of the public health case studies that we looked at, the city of Ottawa, two of the public health staff there were co-located with planning for several years while they developed their new official plan. And one of them focused on, her focus was really to make certain that the official plan really worked around the walkable neighborhood. So making sure that that concept was captured and that kind of threaded through the whole official plan. The other person really worked to ensure that extreme heat was really properly addressed throughout the official plan. And then she actually was involved in the development of a high performance development standard. So that's kind of one option. And then out on Vancouver Island, the Island Health Public Health Unit, where they've got a lot of different small communities. There they actually train their environmental health officers to go out and work with community groups. So they actually encourage them to set up a community health network or to engage with one that exists. And then the idea is that to kind of go and to see what communities are concerned about, what they're working on, and then to bring the support of public health to whatever those issues are. And they kind of had an example there where there was one area where there was very high level of air pollution because a lot of people used wood wood burning fireplaces to heat their homes. And they actually then started a whole program around shifting people away from those wood burning fireplaces and eventually shifting them now to heat pumps. That's kind of what they've been doing now. So there's a number of examples of just different ways that public health can work with municipalities. And the other one that I thought was really useful in Vancouver, the city of Vancouver, Metro Vancouver, again, where you've got a provincial, an arm's length, like an arm's length body of the province. What they do is they actually go and they meet with key officials responsible for the big land use and transportation planning policies for the city, and they kind of go and meet with them and they talk to them about their health and health equity concerns, and then they ask how they can get involved, and then they provide detailed comments in writing and that, like others, but they also then will do deputations to city council and that to support progressive policies. And so those case studies really kind of demonstrate a wide variety of ways in which public health is kind of working in some cases to support municipalities in terms of trying to bring those health and health equity arguments in to kind of really support progressive policies that are moving us in the right direction. And sometimes I think with health, usually these things are all good for health, but the health equity piece is the piece that if you're not really targeting that goal, you can miss it. I mean, I think by just investing in public transit, we can probably improve health, but we're not going to get the health equity benefits if we're not really careful about targeting the communities that don't have good access to transit and thinking of innovative ways to address those communities, either improving those communities or maybe providing some sort of on-demand transit service or something for those communities that aren't kind of well served by transit present. So anyway, so people might want to take a look at some of those case studies.
Yeah, no, that's a great information. Thanks so much, Kim, for that. Thanks everyone for comments. There were a few comments here about the upfront availability of heat pumps is also really dependent on the government incentives available. That's absolutely true. In the Atlantic provinces, lower income households can get free heat pumps, and the same applies for low income households, replacing oil heating anywhere in Canada. I would be, and I think all of us will be so happy if this direction is happening also in our province. I know that in Europe there's similar programs as well. Yes, thanks so much for that comment. Thank you so much for the other comment, which is that it is difficult the narrative of climate change has a positive side in Southern Ontario because the weather is nice. So until there is an event that it's in this case, Tim is saying about, for example, food security will become an extreme issue in the future due to climate change. And so that's when people are going to react. There's true about this. I see it also from like that's more on the adaptation side, that it's very difficult to put money in adaptation when you're preventing something to happen. And you're right that we see more examples of municipalities that are acting on like flooding if they experience flooding, and it's very difficult to actually communicate that to the community. Kim?
If I can kind of respond to two things here. One, I kind of see the comment about the heat pump. So just to kind of go back to that, my understanding, so maybe I'm out of sync with timing because things are changing so quickly, but my understanding is that the federal government was actually going to have the green rebate program really directed at low to moderate income populations in the next round. And I think people are concerned that they are walking away from funding those other parts of it. But I think that that there's been a lot of work by organizations like Efficiency Canada and other organizations really pushing to have those green rebate programs really directed at low and moderate income populations to ensure that these are the populations that might not be able to afford to make the investments in their house that would actually benefit most from them from a health equity and kind of cost saving perspective. So I think that's hopeful, unless there's been a change in that, but my understanding is that that was in the book. And then in terms of the comment about how do we get people to care about climate change, I think for me, what I've found lately is that I'm finding that a lot of people who don't work on climate change, who don't think about the things that all of us spend our days thinking about, are actually really noticing the weather and really worried about it. I walk on this trail every day and I see that a lot of people, and people have been saying this week, oh, it's lovely, but it really makes me nervous. The birds are coming back. They're not supposed to be back yet. I had a fisher person tell me, somebody who really loves fishing, saying, oh my gosh, there's salmon running in the creeks right now. They're not supposed to be doing that in the winter. So I've actually had a lot of people saying things to me that suggest that people are getting it. People know that it's not right. We might be liking it at a personal level, but we get that this isn't really the way it's supposed to be. What I'm still finding though is there's a lot of disinformation that people are still saying, but I'm still not sure if we're causing this or not. So I think for us, we still have to really counter that disinformation and keep kind of emphasizing to people that, scientists around the world and how many kind of agree, and how, that this really isn't up for debate anymore. So just kind of add that comment to kind of one of the questions that was asked.
Yeah, no, thanks. That is, thanks, Kim. That's kind of like similar of my experience and the people that I meet in my community. Another question is, I'm curious, especially as to lower income people rent. Are there any initiatives to add the solutions or make them mandatory in rental units that don't have AC units? Are there any current policies around this or upcoming policies?
There's been a lot of work done by some organizations. I know the organization Acorn has been working on this, as has CELA, the Canadian Environmental Law Association. They've been working with some legal clinics, and there's been quite a bit of activity in the city of Hamilton. I think the city of Hamilton, and if somebody's from Hamilton, please correct me if I've got it wrong, but I think that they agreed in principle to look at a municipal bylaw that would require people who are renting to people that they address that. And I know in the city of Hamilton, I think last summer they actually did provide, the city itself provided air conditioners to some high risk people. And so I think that the city of Hamilton is really looking at that issue right now and trying to kind of figure out how you do that. And I think for me, I think at some level, many of us agree that we want to address extreme heat, and particularly for renters, and particularly for people who might be living in tall apartment buildings that are probably just absorbing heat, and if they don't have air conditioning, how terrible that can be and how dangerous that could be. I think what people are kind of juggling with is, we want to see those investments, but we also want to see investments in affordable housing. So how do we get the other levels of government to help support us with some of those initiatives? I think with municipalities, they might feel like they have to choose between building new affordable housing and kind of pushing some of this. And I think there's also concerns on people's part about rents going up because of these investments being put on people. So I think those issues are being wrestled with by a few health units. Certainly the city of Hamilton, they are. It'd be interesting to see what they come up with.
Right. Yeah. We are also interested, and will be monitoring and expecting a chat with someone from Hamilton once the implementation it's happening or the council approved, because it's not yet confirmed the bylaw. But we have or I was in a webinar of there is I'm thinking now exactly which municipality is in the States that they have this bylaw, and they're providing AC units to low-income residents. And admittedly, they were saying that this is not, on the long term, it's not a climate solution, but they just needed to act quickly. So it's a lot of to unpack there, and I'm hoping to have these discussions also in the meeting that I mentioned, that it's still an idea, but I'm planning about the extreme heat and what are the interventions that can happen in the municipal policies. Another question is, are vehicle emissions or heating emissions considered hazardous waste to be treated differently than regular waste? It seems like with all this data showing the impact on health, a designation on emission may increase the speed of transition and expedite decarbonization. Any thoughts?
I think for me, I'll just say, I think when I was talking about vehicle and heating emissions, I'm talking about air pollutants. So I don't know about hazardous waste, to be very honest, but certainly for us, these are absolutely like, they're like I have to say the heating emissions, I feel like there's less information about that for us. There was one study in the United States that said that that they could save billions of, or produce billions of, or how did they say that? They said that the burning of natural gas in furnaces was associated with $47 billion in health-related impacts in the United States. But it was one study that said that, and I haven't seen anything that's looked at it in Canada. But I think already, I mean, these are certainly with vehicle emissions, the air pollutants, we absolutely know these are very toxic and very hazardous. And there's been a lot of work done, but certainly shifting to zero emission vehicles and also shifting people to public transit, active transportation, those are some of the solutions.
And actually, when you were presenting on the topic of actually doing the regular or needed active, like walking from different public transportation options, I had a similar talk recently with some of my members of my community that they're aware of this, and they're actually purposely choosing to hop off of the subway one station earlier so that they can walk this one block. The exact words of my neighbor was that I feel more energized after that. So I think I hope we're doing the right education there in the community of the importance of the walkability. It's another topic of like, are we doing the planning decisions of the city to really support that walkability aspect in the use of public transport? I don't see any more questions. Thank you so much, Jacqueline, for providing a bit more information on the heat pumps and incentive programs thus far on a federal level, provincial as well. I'm just scrolling to see if I missed something.
Well, I noticed there that Jacqueline, who's, I believe, with CELA, Canadian Environmental Law Association, is just pointing out that the new Ontario program for electrically heated income-eligible homes as well. So she's provided that.
Yes, and we presented this program, and I can share with you the webinar. We presented it literally 1 week or 2 weeks ago, where we Clean Air Partnership reach out to the kind of like extended arms of municipalities and their how you call this, co-ops of affordable housing units. So I think we spread the word, and I hope more communities will benefit from that program as well. Thank you so much, Kim, for being with us in this 1 hour, for doing what you're doing, for providing the overview of this report. I share the link to it and recording the presentation slides, and again, a link to the report will be shared with everyone that registered for this webinar. Thanks everyone for being with us in this hour and for your comments and questions. Stay tuned for more of our upcoming webinars and enjoy the rest of the day.
Thanks, Desi.
Thank
Take
you.
care.
Bye.
Bye-bye.